Hello and welcome. This is Health and Longevity with me, Dr. Ruwende, a platform that will look at diseases that are mainly affecting Africans, how we can prevent them, how we can treat them, and how we can manage them. A few days ago, I heard of a sad story that one of our sisters from church had passed on. The cause, it was breast cancer. How old was she? She was 39 years. Did she have any children? No. Apparently, she also lost her sister 7 years ago for the same cause, breast cancer. Now, the unfortunate part about this story is she decided not to tell anyone. And the reasoning was either way she was going to die, just like her sister, whether she tells anyone or not. But is this true? Was she right? In the next minutes, we're going to answer this million-dollar question. Should we blame her? No. Generally, people who have cancer, they believe cancer is equal to death, which is not true. Now, breast cancer. Breast cancer is the commonest cancer amongst women worldwide, and even in Africa. In Zimbabwe, it is the second commonest cancer after cervical cancer. Although we do not know what really causes breast cancer, but we know that there are people who are more vulnerable or who are at a higher risk of getting breast cancer than others. These are, like our sister, people who have a family history of breast cancer. And again, like our sister, people who go beyond 30 years of age without having a child. And also people who have their menstrual periods early, that is before 12 years of age. And also people who go beyond 55 years of age still having their menstrual period. Another risk factor again, having breast cancer in one of the breasts, it could have been treated, but gives you a risk again. Also, people who take too much of animal fat, also people who take too much alcohol and smoking, and people who could have been exposed to radiation, especially during their years of adolescence. Is it possible to prevent breast cancer? Yes, it's very possible. And as these deaths justified? No, they are not justified. We can always do something to improve the outcome of people with breast cancer. We can always do something to prevent breast cancer deaths. Now, the secret is early detection of this disease. Now, here is the major question: how? It's simple. Number one, we need to always make sure that we do early diagnosis of this disease. And then number two, we must always be doing screening. Screening, how? Well, there are quite a number of methods of screening. The first one is mammography, whereby we use machines to check your breast, whether you have breast cancer. And this one usually encourage it to people who are above 40 years of age. There is also what we call clinical breast examination. This is whereby a trained health professional examines your breast for any signs of breast cancer. Now, the third one, which is the most important one in terms of this video, is self-breast examination. This is the most important. Why? Because it's cheap and also any woman can do it. And this one, we encourage it in every woman who has gone beyond 20 years of age. Let us be more attentive as I talk more about the procedure on how we should do self-breast examination. Step number one. Stand in the front of the mirror and check your breast for any changes. Change in your breast size or shape, thickening of the skin in the breast or underarm area, swelling, warmth, redness or darkening of the breast, dimpling or puckering of breast skin, any itchy, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one of the breasts. Step number two. Now raise your hands and look under your breast for the same changes. Now also check for any lumps or swellings in these areas. Step number three. Next, check your nipples for any discharge or fluid secretion. The discharge, it could be watery, milky, yellowish, or blood stained. Step number 4. Lie down on a firm surface on your back and using slow circular motions, feel your breast for any kind of a lump. Follow a pattern to cover the whole breast, starting from the nipple, making sure that you cover the whole breast. Also, make sure that you also check the inner part of the armpit. Make sure you use the opposite hands for the opposite breast. Step number 5. Stand up and repeat step number 4 while standing. Check for the masses around all this area and also check for the other side, making sure that you cover the whole aspect. Step number 6. If you detect any suspicious in either of these steps, don't panic. Just note your findings and visit the doctor. After all, most of these signs, they're not caused by cancer. Now make sure that you do this every month, and do this few days after your period, because within your period time the breast will be tender. 5 days after period is the best. If you're not going for period anymore, make sure you choose one day that you are assigned. But do not panic if you have any of these symptoms. Go to the hospital for further investigations, because most of these symptoms, we get them in women who do not even have the breast cancer. But for you to be on safe side and to be sure, make sure that you visit the hospital as soon as possible, as soon as you have these symptoms. Thank you very much for watching. And remember to subscribe to our YouTube channel and our Facebook page, Dr. Ruwende. Until then, goodbye.